Hey everyone, welcome back to the Unfiltered Fix. Let me ask you something. Have you ever felt like you're doing everything right, but you're still exhausted, foggy, and just not feeling like yourself? You're eating clean, taking your vitamins, hitting the gym, but something is off and you can't figure out what that is? Well, here's the thing. It might not be what you're doing, but it might be how your body's processing it, or in some cases, not processing at all. So today we're going to dive into something that sounds super sciencey, but before you freak out and think this is going to be a hard topic to understand, I want you to understand that this is so important and it could be the missing link in your health journey. Have you ever heard the term methylation? Well, whether you have or you haven't, we're going to break it down for you today. Now, I'll be honest with you. When I first heard about methylation, I listened to a 40-minute podcast, and when it was over, I was still scratching my head trying to figure out what the heck I had just heard. It was like, okay, I think I understand. I think I get it, but also what the actual hell did they just say? So that's why today we're breaking it down in a way that actually makes sense, because you shouldn't need a PhD to understand your own body. In fact, I keep it real around here, and if I can get it, you can get it. So to help me with that, I've brought on one of my absolute go-tos when it comes to hormones and complicated topics like this. That is Leah Onstott, who is our nurse practitioner at Zen Regen, and she's coming to us from Hawaii. Leah is a total rock star when it comes to hormone health and optimization, especially for women going through menopause and postmenopause. She has this amazing way of making even the most complex stuff feel simple and, more importantly, doable. But before we jump in, let me give you my usual disclaimer. I'm not a doctor. I'm just an ordinary person like you, trying to live my best life and figuring out how to optimize my health. I'm not here to offer medical advice. And while Leah is a licensed provider, she's also not giving you personalized medical advice today either. What I am here to do is share my knowledge and experiences in hopes that it sparks something in you to be a better advocate for your own health. And while today's podcast is mostly geared toward women, methylation is an important piece to men's health too. So maybe we'll cover that in a later episode. Let's get into it and figure out how methylation might just be the missing piece in your wellness puzzle. Leah, thank you so much for joining me today.
Absolutely. It was great to be here.
And I always love seeing your face. I miss having you around the clinic, but I love being able to be face-to-face with you today.
I miss you guys too, but I can't complain.
I know, it's absolutely beautiful. I hope you're soaking in all that vitamin D there. I want to start with breaking down what methylation is, because I feel like, again, it is one of those topics that it is a little bit more complicated to understand. So I would love to hear how you would phrase it for our listeners today in a way that they might be able to understand.
Absolutely. It's definitely a topic that can make one's eyes just kind of glaze over because it is really complicated. It sounds complicated, but simply put, it's a process that turns your genes off and on and repairs your DNA. For instance, it works on neurotransmitter synthesis, helping to process serotonin and norepinephrine. It helps the immune and inflammatory processes. For instance, if it's not working, things like rheumatoid arthritis, lupus, or Hashimoto's thyroiditis. It helps cholesterol balance via homocysteine. It helps convert vitamins, minerals, antioxidants. It helps with fat metabolism, your stress response. It helps with detoxification. And obviously, it helps with hormone production and metabolism. So it can affect so many different areas of the body, pretty much all areas of the body. So symptoms of methylation problems could be things like fatigue, anxiety, depression, the list goes on.
Yeah. So methylation is one of the key processes that your body uses to take nutrients from your food or supplementation and actually turn them into a form that your body can actually use. So if you think of it like you're eating healthy and you're giving yourself these raw materials, methylation is the actual assembly line, if you will, that transforms those raw materials into something functional. So an example of this would be like if you're eating lots of leafy greens for folate, which is vitamin B9, your body needs to methylate the folate in order to put it into like an active form, which is the methylfolate, for it to actually do its job. So like you had mentioned, supporting the DNA repair, producing neurotransmitters and detoxification. If methylation isn't working properly, that folate just sits there unused, and it might still be creating some of these symptoms of folate deficiency.
Correct. And that's how it folds into the turning the genes off and on. Yes, absolutely.
Can you explain how methylation specifically impacts women during menopause and postmenopause? Is there a difference between, somebody that maybe is having issues with methylation during their fertile years versus your area of expertise, which is the menopause, postmenopausal phases of women?
Oh, absolutely. Methylation deficiencies have been linked to things like menstrual irregularities or even infertility, as well as influencing menopausal symptoms. So as it's modifying the genes as those, what we call methyl donors, which can come from nutrients and supplementation and lifestyle, as those methyl donors are not being utilized properly, that's going to change your hormone receptor, and that's going to change the balance of your hormones. So it will alter how your tissues respond. For instance, one of the big examples of receptor difficulties is breast cancer with receptor positive cancers. It's going to affect how your body utilizes your hormones with metabolization. The hypothalamus is a big part of where the hormones are beginning to be produced, and it's going to affect the expression of those genes responsible for hormone production. So all the way through, from onset of menses through menopause, it can have a big, big influence.
Because the regulation of hormones, especially when it comes to like estrogen and progesterone, if our body is not methylating, like being able to actually push out these hormones, it just kind of builds up and that throws off our balance, right?
Absolutely true. And I've seen in some of the reports that I know we're going to talk about later, I've seen people that produce plenty of hormone, but they're not methylating. And if you don't get that methylation corrected or improved, then you're just going to continue to build up those levels of hormones, and that could lead to DNA damage. So it's really critically important to get the methylation on track.
Yeah, for sure. And we know that there are millions of different gene SNPs that we all have, and genetic variations like MTHFR, MTR, and we know that these can affect methylation processes. How might these genetic factors influence a woman's experience of menopause?
There's less research for hormones on the MTR and some of the other ones, but MTHFR, there's a lot of research on that. And in fact, up to 50% of Americans have the MTHFR variant, and that it affects how the body breaks down and utilizes your folate. 50% of Americans.
That's huge. And I bet most of them have zero idea that they even have it.
Exactly. It's a very specialized test to figure that out, and no fault to a primary care doctor, but it's just kind of not in their wheelhouse to dive deep like that. They're not taught to look for zebras. They're looking for horses. They're looking for the more obvious fix. And this is not an obvious situation, but it can be tested. It definitely can be tested for. A lot of times it will be tested for in situations like infertility or pregnancy loss, things like that. They will test that when you're at a specialized clinic in that situation. So it definitely has an effect on hormones, leads to increased homocysteine levels, which can then affect mood swings, fatigue, breast cancer, cardiovascular disease. It can intensify the vasomotor effects or the hot flashes, the vaginal dryness. It can definitely intensify those things. And we talked about depression. It definitely, with the neurotransmitter synthesis, it's anxiety. All of those things can definitely be affected by MTHFR deficiency.
I know in our clinic, we hear this a lot. Somebody will try and advocate for themselves. They'll go to their primary care doctor and ask for them to run these tests. And they're like, not medically necessary, not putting it through, not requesting it. How would a person go about getting tested to see if they have healthy methylation?
The way I do it typically is with our Dutch test, but there are specific MTHFR testing. You would probably need to be either with a functional medicine or integrative medicine clinic, such as Zen Regen, or there are many others out there, but it's going to be rare to find that in a primary care facility.
And then through genetic testing too. That's how you would determine if you have one of these mutations.
Yeah, right. With genetic testing. Yes.
Not everybody has $600 to throw out, but
Exactly.
if they can, it's always nice to have those baselines so that they know.
Absolutely true. It's just for primary care doctors, again, not throwing any shade on them at all. This is very specific testing. It's very detailed testing. And they honestly aren't allowed the time to dive into things like that. Most of them. Some of them will take a particular interest. So yeah, you need specialty care, specialty clinic.
Is there any advice that you have for somebody that might be utilizing a naturopathic doctor or a functional doctor to go through this process? Like, can you help guide them on questions they should ask or things that they should be looking for when they're going to one of these specialty providers?
If you're with a naturopath or a functional medicine, integrative medicine facility or a physician, one would hope that they would be on board with checking those types of variants. I think if you just present your case of I'm doing all the right things, or I feel like I'm doing all the right things, but I'm just not feeling myself. If you're listening to this podcast and you're learning about methylation and think, oh, maybe that's me, you just ask, what is this MTHFR? What is that? Is that something that might be applicable to me? Yeah, you just have to be brave enough to ask the questions, really.
And can you explain to our listeners what happens when they have that gene mutation? What nutrient is it that they might potentially be deficient in?
Well, it's less a deficiency in the nutrient than the body's ability, and it's folate. Like you said, B9. It's a really big, long word that I never try to pronounce. I love the abbreviation, MTHFR. But folate is responsible, obviously, for, if you think pregnancy, folic acid is vital in producing the neural tubes. Neural tube defects can result in things like spina bifida, cerebral palsy, and can be devastating to a pregnancy. It can cause a pregnancy loss. The roundabout way, that's why it is recommended that you up your folate dose when you're trying to get pregnant and while you're pregnant to prevent those types of things.
And it's also important just to continue taking as you get older. We all need help
absolutely.
In that way.
Yes.
I have to laugh when you actually spell out MTHFR. It kind of looks like mother, and so it makes me laugh.
It does.
It's like, if you're feeling all these symptoms and it makes you want to say that, you might want to look into whether or not you have that.
That's a great way to look at it. I love that.
All right. So does methylation status influence the effectiveness or safety of hormone replacement therapy in menopausal women?
Most definitely. I alluded to this earlier. If someone has poor methylation, they're not going to break down or metabolize or utilize their hormones effectively. When it's functioning well, your estrogen metabolites head down 3 different breakdown pathways, one of them being very protective, one of them being just kind of moderate, and then one actually having negative effects. So if you're methylating properly, you're going to push down that protective pathway. And on the flip side, if you're not, you're going to push down that negative pathway, which increases oxidative damage to the cells and what we consider to be a proliferative pathway, which can lead to cell changes. You're proliferating cells or you're growing cells in a negative way, which can lead to changes like cancer, breast cancer, prostate cancer, things along that line. So very important to methylate properly.
Are there specific lifestyle changes or interventions that can actually help support healthy methylation during menopause?
Yes, for sure. Many of the same recommendations that we talk about when we're talking about an overall healthy lifestyle, getting regular physical activity, eating clean, plant-heavy, Mediterranean-type diet. I spoke a minute ago about methyl donors. So some of the food that we intake and or supplementation are actually methyl donors, which will support that methylation, like dark green leafy vegetables, legumes, eggs, brassicas like Brussels sprouts and broccoli, nuts and seeds, limiting those processed foods, eating more whole grains and less added sugar. Stress management is huge. Breathing exercise, meditation, getting adequate and healthy sleep. Megan,
Working on it.
Not smoking, making sure you have a healthy gut dysbiosis in the microbiome are proving now, we're seeing in research that that's a big player in methylation. And then, of course, there's certain medications that can affect methylation. So oral contraceptives is a big one, along with anticonvulsants and antituberculin meds, which we see less and less of. But yeah, there's a lot of things that can affect methylation in lifestyle.
How would you go about coaching somebody through this? I know you and Dr. Ruby work very closely. I've had her on as a guest of the podcast before. Can you give our listeners just kind of like a little insight into your your area of specialty and then how you work with Dr. Ruby to make sure that we're touching on all of these components when it comes to somebody's overall health and wellness when they come to us at Zen Regen.
Absolutely. I love working with Dr. Ruby. She's phenomenal. She's been such a great addition to the clinic. So my area, again, is perimenopause and postmenopause. It's my love. I just really thoroughly enjoy working with these women. And I'm starting to work with some men on testosterone replacement therapy as well. And it's been an absolute pleasure in that region too. But what we're going to do is we're going to take a really deep look into their lifestyle. We're going to talk about all of the things I just mentioned. We're going to talk about sleep. Most of the time with my patients, they're going to come to me with these complaints that they're not sleeping well. They're high stress. They're not managing their stress well. Maybe they're not eating well. They've had weight gain. Their periods are irregular. Their moods are irritable and, higher anxiety. The list goes on. But we're going to look at that. We're going to recommend some specialized testing. Again, I use the Dutch test, which we can talk more about. And once I get that Dutch test back, it gives me a really great idea of how I need to approach it. But many times I will go ahead and refer them to Dr. Ruby for other lifestyle questions. If they have gut issues, if they are already working out really well and eating well, but just can't get their motivation back. Once they've started a hormone pathway and started some supplementation and possibly replacement and just not feeling the changes, and then definitely I'm going to recommend that they go see Dr. Ruby and dive maybe a little deeper into some different areas.
I think it's so important for everybody to know because we've already said, your primary care, they're not looking at all of these different areas. And I think a lot of providers out there try to specialize in all of the things. And it's like one of those individuals that's like a jack of all trades, master of none. And I think it is so important to find providers or a team of providers that work together that have these specific areas of specialty so that they can really manage all of the different moving pieces to your health.
Oh, I couldn't agree more. I love having a team. I really do.
And we have the best team. And I know that bone density concerns increase with postmenopause. We know this. Is there a link between methylation and bone health that women should be aware of?
Absolutely. Methylation directly affects bone formation and resorption. So it can directly affect your bone density. I mean, that's where getting that adequate physical exercise, getting that impact loading, which strengthens bones, strengthening the muscles, which is going to put tension on the bones, which also increases bone formation, getting the right nutrients, whether that's through diet and or supplementation. These are all part of the natural aging process because methylation does slow down naturally as we age. So even though it mentally and physically may feel like it's time to slow down, it's actually the time to kind of ramp it up and make sure you're on a good pathway to maintain that bone health. Yes,
absolutely. And I'm so excited that that's one of the things that we're going to be bringing into Zen Regen here in the next few months is the DEXA Plus, so that we can actually establish what that baseline is, because I think it is so important for women to know what their bone density looks like. I mean, I think most people, until they are postmenopausal, they have no idea.
No, and in primary care, just insurance coverage is not going to cover a DEXA. I think they did drop it to 55, but it was 60 for the longest time. And there's a certain demographic of people, smaller, maybe not having had children, years on birth control or other medications. They're at higher risk for osteopenia and or osteoporosis, and you can't get tested unless you pay out of pocket until you're a certain age. I think that's,
and I know that
we
like the research behind all of this stuff, and I know that I want to keep it somewhat simplified for everybody. But what emerging research or developments in the field of methylation specifically could potentially change how we approach menopause management in the future?
Well, I mean, I just did a quick search to see what was available in recent research. There's a lot of recent research with methylation. A lot of it is looking at diabetes, neurologic disease, autoimmune disease, and cancers, of course, but there's definitely more research going into PCOS, which is wonderful for those women because, again, methylation is a huge part of that.
That's one of the things that Dr. Ruby and I just talked about not too long ago.
Mm-hmm. That was a great podcast. But one of the things that I think is going to be really important is that there's more research looking into the microbiome's effect on methylation. And I know that ISSR is heavily involved in the microbiome research arena. But yes, to me, that one is going to be really important to see what comes down that.
I am really excited for that information to come out for sure. All right. So now that we've broken down what methylation is and how important it is for your body to actually use the nutrients you're giving it, let's talk about something super actionable, something that our listeners can literally do today to start feeling better, which is switching to a methylated multivitamin. I feel like this is one of the simplest ways to support your methylation pathways without overthinking it, because again, not everybody has access to genetic testing, or not everybody has the means to go through that process. But most people don't realize that their typical multivitamins that they're taking might not even be doing what they think they are, because if your body can't methylate properly, those nutrients just aren't getting used. So some people might be saying that they get all of their nutrients from their food and they don't want to supplement, which is totally a personal decision. And that's fine if that's your belief. But I personally don't believe that you can get all of the nutrients that you need from our diet alone, or at least it's really hard. Might be nearly impossible these days because of all of the garbage and the pesticides that's in our food.
I completely agree with you. I completely agree with that assessment that yes, you can eat as clean as you want and buy organic and, you know, buy from the farmers at the farmers markets. You can do all those things, but our food has changed so much in the past 50 to 100 years that we're simply not eating the same thing that we were 100 years ago. Supplementation can be very important, especially in the case of an MTHFR defect. Methylated vitamins. And if you don't know, you don't know. It's not something people think about. They are available, but they're not a lot of times available to the general public. You need to go through specialty ordering to be able to get that for them. So finding the correct folate, the correct B vitamins, the other methyl donors, choline, betaine, there's a lot of them. But we want to make sure that your body is going to be able to utilize them. Otherwise, you're wasting your money.
Yeah. Even if you're eating all your leafy greens and loading up on B vitamins, it's kind of like giving your body raw materials that it can't process. But when you take a methylated multivitamin, you're giving your body those nutrients in a form that it can immediately use. So no extra work is required. I think breaking it down a little bit better for your body to process. We talk a lot about bioavailability, but I think this is definitely an important component.
Absolutely true. And whether you have the deficiency or not, I mean, it can be beneficial. So it's not going to hurt somebody that doesn't have the MTHFR deficiency to take a methylated vitamin.
Exactly. You're just covering your bases. Perfect. Well, are there any other pieces of advice that you want to give to our listeners or kind of help educate them any further on this topic?
I think really be willing to have the conversation and just understand that, you know, you may be for menopausal or perimenopausal women, as you're experiencing these menopausal symptoms, it's not always as simple as a hormone replacement cream or pill or patch or whatever form we decide to use. We may have to do some work, and it's going to take time. It's not going to be an overnight fix. Correcting a methylation issue can take several months. So be patient, but we can get there. We can definitely get there. We've got the testing to watch how it works. And once it starts working, you will feel so much better.
I think that is such an important piece to all of this is we didn't get to where we are overnight, and people this day and age want that quick, immediate fix. And unfortunately, when it comes to our health and wellness, that's just not a thing. So being patient, giving your body an opportunity to adjust, and being consistent with all of these different changes is the key to all of it.
Yes, consistency is key, as particularly when you're talking about supplementation or, you know, taking things that are going to correct something like a methylation or even a hormone. Once we get to replacing hormones, it's going to take time. Your body has to build up and refill up those hormone receptors. And yeah, it just simply takes time.
Awesome. Well, Leah, thank you again so much for joining us today. It's always such a delight to see you. And if anything that we talked about today resonates with you, don't keep it to yourself. Share this episode with your friends. Make sure that you subscribe to my YouTube channel so that you don't miss any great episodes that are still to come. And of course, you can find me on Apple Podcast and Spotify. We look forward to seeing you next week. Have a wonderful day.